Hey everyone, welcome back to the YMyHealth Podcast. And this is one of the most special or the most special podcast episode that we've had. This is episode 100, and Julie and I cannot believe it.
Woo!
Yeah, very, very excited to be here and to be celebrating this moment with you. We definitely couldn't have imagined that we would reach this when we first started the podcast in January 2025. Right, Julie?
Yeah. Yeah, it seems like so long ago and so not that long ago at the same time.
Absolutely, absolutely. And as we kick off this episode, we have to tell you that as all of you have learned as you listen to our episodes, so much thought gets put into each episode. And so even though we actually started the podcast technically in January 2025, we began planning for it all the way back in October 2024. So it's been going on a long time. It's been a long and very exciting journey, which we're excited to talk to you about on this episode. And we first have to start with expressing gratitude to all of the people who made this possible. As each of you know, sometimes you go to your friends, you have this idea to start something, and sometimes you receive, a positive reception. Other times people say, "Are you sure you want to go down that path?" And in this case, this received such a positive reception. And Julie was the one who came to me initially in the fall of 2024 with this idea of moving us from being more article based and Instagram live based to a podcast. And so first we got to give credit 100% to Julie for this amazing idea.
Thank you. Yeah, I'm so glad it's been so well received and that people are really, really engaging with it and enjoying the stories that we're telling.
Absolutely, absolutely. And I think what's really unique too is because we've done so many different types of content, I think it really is so reflective of the millennial journey, right? Because
Mhm.
so many of us, and this is a common theme in our generation, there's so much change and adaptability, right? To change.
Yeah.
And so as we've seen how the people in our community, our fellow millennials, the different changes that have happened in their lives, and obviously becoming more and more busy with more on our plate, we really recognized how we could have much deeper conversations with you in a way that you could take and multitask and take it with you, be portable, and listen at a time that worked for you, and stop and start and really just get to fully engage with the material. And so we were really excited to be able to do that. And speaking of other thank yous, right? When we initially started this, first of all, a huge thank you to our social media team of Kindle Media Co. So both Jasmine Duncan and Kendall Hackett. When we told Jasmine, I think of anybody we told initially, she was the most excited person that we were going to move this to a podcast because she just knew, like you, Julie, how wonderful it would be to be able to listen wherever you were, and in depth. And so we're so grateful to them for helping to promote the podcast throughout, and just being so creative and adaptable as we made all different types of changes, like so many in our generation do. And then also we must thank Sarah Jane Ponce, who is the CEO and founder of Digital Lumad. Sarah was the one who helped actually put the podcast into real life, in terms of putting it on Spotify and Apple and creating cover art and all of those things. She's taught us a great deal about episodes and episode editing, and we're so grateful to her for helping us get to this milestone and bring this great idea to life. And then also Dr. Sarah Diekman of Diekman Dysautonomia. You've heard her wonderful commercials. She has been our podcast sponsor from day one and so supportive, so excited about this idea. And we are so grateful to Dr. Diekman for her support. I think one of the things that has been the most wonderful surprise of this whole experience, now, obviously, the conversations we have and the incredible guests we have has been so heartwarming, so rewarding to be a part of this for both of us, with all of these individuals who've become contributors. But I think we've been so surprised by the level of enthusiasm that people have, regardless of whether or not this is somebody who's sharing their patient story, somebody who's a researcher who wants to bring research out into the world, somebody who is an entrepreneur. whether they're coming to us from a big organization, a small organization, trying to start their own social media platform to take and share their personal story. The level of excitement has been really incredible. And I think sometimes too, I find very surprising, and I know you have as well. We'll do an episode and you never know. That I mean, we were familiar with how popular certain topics are versus others, but you never really know what the reaction is going to be. And you get really surprised when people reach out to you and say, "Oh, I was affected by
Yeah.
this particular topic. Thank you so much for sharing. People don't talk about it enough. I can't wait to show this to someone." Another thing on our clinician side, that's more on our patient side, but on our clinician side, one thing that's been very surprising, and I know Dr. Diekman has done this a lot, and Emily Labuda, who's a licensed professional counselor, who joined us as well, they will take these episodes that they're featured in and they will share them with their patients to
Yeah.
explain something. And they've told us that that has helped so much as well. So just some really wonderful surprises that we have experienced. What about you, Julie?
Yeah. I mean, it's you look back on the episodes and obviously with 100, we can't dive deep into every single one, but I think that theme of just health is so personal.
Yep,
And I it's been such a joy and a blessing to have people come onto that podcast and be so open and honest with us because I think that's why we get the engagement that we do. I know recently Bailey Pilant came and talked about neurodiversity and her diagnosis with ADHD at 17 and autism at 30. And I think, she talks a lot about how women are missed because the symptoms don't fit and how she is one of the examples of that. Um, and so, yeah, I think you see a lot of that, like just open and honesty with things that have been, historically not really talked about or things that maybe make some people feel uncomfortable. Um, and by having those conversations, I feel like you just start having or sharing the language for other people to talk about those experiences.
absolutely. And I think what's so interesting about that, I saw the other day when I was looking at our analytics that somebody actually was going to that episode uh, from another country. Can't remember which one
Yeah.
right now, but from another country. And that's something we
Yeah.
see a lot is we see people going to the episodes on a regular basis from Australia, from the United Kingdom. Um, I believe hers may have been Italy the other day. Uh, a lot of different places. And I think that's because of that openness and
Yeah.
also the research backed evidence.
Yeah.
I think is so huge. So many places will provide you with health information. Maybe it's true, maybe it's not true. That's something that's been at our core from day one. Whether it's something that we are researching in a journal ourselves that we know is a reliable journal, or that we've spoken and brought on a healthcare expert to speak
Yeah.
on that or have checked with them, we're never going to bring you something that isn't um, credible, a piece of health information. I think people are looking for that, and sometimes it can be so overwhelming to get that information. So we try very hard to provide that to you in a way that is very actionable and useful in small pieces. It's a lot easier that way. But yeah, I think that combination of to your point, of being open, that personal story, and then that evidence-based, information. It again, the reaction has really surprised us.
Yeah.
And, and knowing that, I think we really, as I said in the beginning, like, we really plan things out, and we continue to plan things out, including this year for 2026, and one of the ways we've done that, obviously, is talking to people in the millennial generation around the country, right? Because we can't we know what is of interest to us, but we need to know what's of interest to everybody, and I think that has been incredibly, helpful, and it is totally integral to what we do. But also, based on that, we know the common themes and topics that you're interested in. And so we have followed those to map out this podcast as we've planned each episode. So, you know, what are some of those for you, Julie?
Yeah.
Um,
I think one of the ones that I just really stuck with me personally was caregiving. we've seen a lot of popularity with our caregiving pieces. And um, I think two of the episodes that really touched me
Mm,
specifically were one of our earlier Fight CRC episodes with Jennifer French. She's
yes.
an LGBTQ plus caregiver, and unfortunately, her wife passed away while she was expecting, and so I think it it was just really um, amazing to just see how complicated caregiving can be, both emotionally and logistically and mentally, but how, it is a form of love, and it's, also just the way that it's projected in, exhaustion, advocacy, fear, responsibility. There were so many elements in that story that just were so incredibly, um I think eye-opening, but also, like, motivating, and really seeing Jennifer's strength was just, something that really stuck out to me. Another one also, from Fight CRC, but from this year, I got to sit down with Antonio Dionizio, and
Yeah,
he was talking about his father, um, and caregiving for him, and, it's having him be so open, and he started tearing up. It makes you start to tear
absolutely.
up as well. It's just those episodes that I think really expanded the way that I think about health. And we talk a lot about patients, or a lot of the kind of like conversations about healthcare are related to patients, but caregiving is healthcare too. And so
Absolutely.
um caregivers are often carrying a lot of this emotional weight, in addition to like physical weight of caring for someone, and it doesn't seem to get talked about a lot. And so I feel like that as a topic has really hit home with our audience, because we're the ones just having the conversation when a lot of places maybe aren't necessarily there yet.
Absolutely. I completely agree with you about the caregiver theme. I think caregivers are the unsung heroes uh, of the healthcare system and of many of our lives. What's interesting is the change in the face of the caregiver. People don't look at a millennial as a caregiver other than as a caregiver as a parent.
Yeah.
They don't look at it beyond that, and I think our episodes really changed that. The one that stands out for me is really our episode with Carrie Alberts, who is also known, very well known, as Dementia Darling. Um, and we were so thrilled to have her on the podcast, and she really gave us kind of a more like global view, I would say. She shared some of her personal story about how she got into the caregiving space, watching her father care for her grandmother um, with Alzheimer's. But the thing is that it was just like her kind of diving into the day to day, all the things that she's seen all these years working in assisted living facilities and other places, and how really redefining what a caregiver is, that it's not even, she doesn't just see millennials, she's seeing young kids, she's seeing teenagers who
Yeah.
their day starts really early helping an older adult relative with a different health condition. So I think that was really, really eye opening too, and something that we want to continue to do more on.
Yeah, absolutely.
Good. Yeah.
Another theme that I saw come through a lot is um just like invisible struggles. I think
Yes.
there's so many uh topics, or like kind of subtopics that fall under that theme, that we could talk about, that we've addressed on the podcast. But some of the ones that um, I think were maybe like, standalone, unique pieces. We had Amy Hart come on and talk about her life after colon cancer and having an ostomy bag. Um, and I think that is something that, again, not really talked about a lot. And she really um, is challenging those assumptions of, I think people hear ostomy and they imagine that there's some sort of limitation because you have one. And she's actively showing, what it looks like to reclaim your life. And she does that all a lot on her personal social media, but she also just talked about it in the episode. And I think that was a really good one, because you would never know, truly,
Exactly.
that's something that she's dealing with, unless you were to be following her on social media. Um, Another one that was really popular that we saw people engage with a lot was our PTSD episode with Jake Narotsky from Wounded Warrior Project. And just having him be so vulnerable around, PTSD and what that healing actually looks like. He talked a lot about, um, those invisible mental health struggles and how opening up is so difficult for some people and how healing often isn't linear. And he's coming at it from a veteran's perspective, but he really did also relate it back to people, just anybody who has PTSD from some kind of traumatic event. And so I think like those were two examples of invisible illness or invisible struggles that came through that I thought were so interesting, because they're things that I'm, at least personally not thinking about on a regular basis.
Sure. No, absolutely. I think the idea, of invisible illness is very hard for people to understand. And I think it gets even more compounded by the age group that we're in. And so, yeah. And so to have the opportunity to have these incredible individuals on the podcast talking to us about that and like what day to day looks like for me, very much with Dr. Alexandria Yarbrough and also Dr. Sarah Diekman, who we mentioned earlier, who both live with POTS and different POTS comes in lots of different forms. And to remind everyone, POTS is postural orthostatic tachycardia syndrome. And like lots of different syndromes, some people have symptoms that affect them enormously where they can't get out of bed, and other people are able to go to work, but they need accommodations at work due to
Mhm.
fatigue or temperature dysregulation. So everybody looks different, but on the outside, they can look totally fine, right? And so it was really wonderful to have them on talking about POTS. Uh, and I think, to your point, that's just something that I think not only is so inspiring, but so informative because people in our generation really do want to know and really do want to help. And a lot of times it's just a matter of the fact that they don't know because
Yeah.
they've never been given an opportunity to learn. And so I think we definitely provide that there. And Bailey is another individual I'm thinking about too. We were talking about, which was an excellent episode with her for sure.
Yeah.
Yeah.
Kind of on that theme, and also, you
Yeah.
know, a few minutes ago, you were talking about the research element.
Yeah.
Another theme that came up throughout our conversations and throughout, um, the feedback that we've been getting is about prevention. Just
Yes.
especially for our age group, as we continue to see things like colon cancer on the rise, um, that, really is one of the themes that we see a lot, both from the physicians who have spoken with us and the patients. And
Yeah.
we did a lot of pieces that we talk about that. I think one of the more recent episodes that we did was with Bill Talk, and he talked
Mm.
about, how to read health headlines without panicking. And I think that's huge for us in this day and age when every headline is, supposed to be eye-catching, and you're trying to drive engagement. Um, they can be misleading, and it causes, fear and confusion. And um, I think this episode in particular was one where um, the the prevention is almost on the fear and confusion around these health headlines. Um, and that was kind of like an interesting take to me, really coming down to the fact that just health literacy matters, that's,
Yes.
so key. Um, I think another one that we did that was interesting and very relatable for most millennials is breaking the cycle of burnout with Emily Labuda.
Oh gosh, yeah.
I think we've all
Me either.
experienced it. Yes, and it's so hard, and it is different than just regular stress. And so I felt like, yeah, um, when we're, trying to function at full capacity all the time,
Yeah.
it's hard. And, you know, I think the takeaway there too is just rest isn't a reward, it's necessary. So that was a really interesting prevention one that's maybe a little bit different than what you might typically have imagined when you think about prevention. Um, but yeah, it's a through line through so many of our episodes and so many of the conversations.
Oh, absolutely. And people like they just want the information. to take
Mhm.
and properly prevent conditions from happening. And also your point about the research and be able to understand the research and put that as part of the steps towards prevention. So I'll say a couple that stood out for me in both those areas. So one, I know that when we kicked off um, the podcast, so our second episode was actually on primary care. And it was so interesting. Yes. Remember, I know this is
Yeah.
way back when, so we're both like, oh, yeah. But it was so great because one of the things we hear often, and we do hear this because we're a part of the colorectal cancer prevention community. Um, we hear continually from people, particularly guys, how many guys do not have a primary care doctor, let alone go, do not have
Yeah.
it one established, and what a problem that is. And obviously, people don't recognize um, that that's one piece in the whole preventative process for what we're hearing about often for the colorectal cancer, but for a lot of other things too. And it
Yeah.
was fantastic in episode 2 to have Dr. Jeremy Newman on, um, who is a primary care doctor from Allied Primary Care. And it was so great because not only is he a primary care doctor, but he is in the actual demographic um, that is and a male physician who is in the demographic of people who are not going. And so to
Yeah.
hear from him why uh, primary care is so important, not just for women, but also for men, that was incredibly helpful and kind of set the stage as we moved into all these preventive episodes. Far as the research stuff, I am there's no secret. I'm a huge fan of research, been involved in research since my college days. And so it's been such a thrill to see how many people are interested in learning about research, how to read it, listening to our episodes. I think part of the problem with scientific research is people think they're not smart enough sometimes to understand it or to read it, or it's not for them because they don't have a master's or a PhD. And as we've said from our earliest days of the podcast, that is just not true. Everyone has the ability to read and understand research and should, you know, they should be able to have access to it.
Yeah.
Everyone, regardless of what you do for a living. And with health research, it's so important. And so we have had the opportunity, some of my favorite episodes, to have people like Dr. Fola May come on. Dr. Fola May has been a huge supporter of Why My
Yeah.
Health and the Why My Health podcast. We're so grateful to her for that, but also for her incredible work in trying to save lives from colorectal cancer. And so she's really come on and not only brought research to life, but in this particular area, we're talking about Bill Tack,
Yeah.
headlines. All we hear are these headlines that are really scary about how many people under the age of 50 are getting colorectal cancer, and they're unfortunately true. But that being said, there's a lot of talk about what the causes are, and maybe they're not necessarily what you're reading is more fear mongering than what is true. Um, you know, when it comes to getting tests, when you need the test or what type of test, and it can get really confusing,
Yeah.
and people can be very fearful. And so it was great to have her on to really put things into context so well about what we're all hearing in the news, what we're all reading, what we're all seeing on social, when you need to get a screening, who needs to get a screening, the different little, details that are all being missed when these things are being reported, and also really to get to the root in terms of causes, which they don't know why. It's such a complex problem, and it's very complex to find the solution and the answer as to why these numbers are rising. But we were able to really talk with her about one of the big things that we hear about often is, well, it's because of obesity. And the interesting
Mm.
thing is, it was so fabulous to get to ask her that question because how many people have we had that we've interviewed who have had colorectal cancer and they weren't obese and they were big exercisers and ate healthy, so that it was great to be able to ask somebody who's an expert in the field the question, so why is this always mentioned? And she was able to really provide context into why that is the case for some people, but not necessarily for the majority of people.
Right.
So So that was a great one. The other two research ones, as far as prevention that stood out to me were Molly Sherwood's from Aloe Hope Foundation. We were very surprised because you never know, as we say, we know people are interested in research, but we don't know what the response will be. Hers ended up being one of our most listened to episodes of all of 2025, which was amazing and so exciting to see that people were so interested. So she really talked a lot about patient-centered research and what that means and how you can get involved, because everyone's view of what being a study participant looks like may be very different than what it actually is. And so she was really trying to make research accessible and understandable for people. So that was a great one. And my other, which is an absolute favorite, was our episode on the global think tank, Fight CRC's global think tank that is working with multiple countries. I believe at least 17 countries around the world to try and find answers as to why the number of colorectal cancer cases are rising and what those causes look like, and not just the cause, but also how to identify risk and what risk really means. And that's a huge piece of the puzzle in figuring this out. And we had the privilege of having Andy Dwyer on and Kieran Logan, who are leading that think tank for the next another year from now, actually. So 2-year long think tank. So that definitely research and prevention and the two together, huge theme for us
Yeah.
commonly.
Yeah, it's interesting. This just made me think of also
Yeah,
our episode that we did with Ben White, where he also talked about health policy and,
absolutely.
the tie between personal experiences and the larger healthcare system. I think there's, between the research, between the individual health stories, you know, there's people like Ben,
Yeah,
who are helping to connect the dots between those different pieces. And that really does shape the way that we access healthcare, and the way that we talk about it. So I think those stories are so important. Um,
incredibly. And I think policy and advocacy,
yeah,
definitely something people are interested and want to know how they can get involved.
yes,
Very much
for
so.
sure.
Yeah. Yeah.
And I think maybe the last themes
Yeah.
that came through, and you sort of started to touch on this as well,
Yeah.
um, were related to some of our episodes where we did more deep dives into either men's health or women's health.
Yeah.
So you mentioned that, you know, we talked to Jeremy Newman about men not
Yes.
necessarily going in for regular checkups, things like that. One of the episodes that we did was with Jay Abramovich with Man Up to Cancer. And he was talking about how isolating illness can be for men because of, social expectations
Yeah.
around like strength and vulnerability and all of these things. And so, um, you know, in addition to men either just like not thinking about it or not being a priority, there are also these, I guess, kind of like gender norms that are changing the way that they think about or experience healthcare and emotional support. And so I thought that was a super interesting episode as well,
It was.
tying into the fact that they're not even, getting checkups, let alone, if they're going through a more serious illness, what that care looks like for those individuals. So yeah, I thought that was an interesting kind of perspective on men's health. But I know that you had the opportunity to a lot of women's health
I
this
have.
year in particular, or this
uh,
past, calendar year or
Yeah.
so. So maybe tell us a few of those that really stood out to you.
Yeah, for sure. Well, first of all, Samantha Gonzalez Russell, her episode, Sam, we call her Sam for short. Sam is just an amazing, amazing human being, 3-time cervical cancer survivor. Um, you know, she is a fellow entrepreneur, trying to make things better in the healthcare space. And so I think, um, her episode just really touched me personally. I think her personal story is incredible, so informative about helping women to advocate for themselves and their health. Had she not advocated for herself, she would not be here today and have been able to talk to us on the podcast. And so I think really talking to people about those steps, talking about how she was never necessarily naturally an advocate, which is the case for so many people. It's hard to speak up when you're in different situations. And so just really, again, with that openness, talking to us about that, telling us some practical steps that she would advise people take. So going even beyond, telling us obviously the symptoms and signs to look out for cervical cancer, but going beyond that, if you were to find that, what do you do? Right? So I think that was really an incredible episode, and she's just a huge advocate for women's health with her newly found company, Evergrow Healing. And then very recently, also, um, Janae Finley, who is a physical therapist here in Atlanta at Iris Breast Cancer Rehabilitation. The pleasure of sitting down with her, and her personal story is just incredible. And I think really speaks to the point not only about women's health, but also if you're a woman, excuse me, who happens to be in healthcare for a living. There's always a thought, whether whatever gender you may be, that if you're in a certain industry and you have a problem within that industry, that you know what to do. And so it was really such an interesting perspective for her to address the fact that she was in healthcare when she found out she had breast cancer, but and a physical therapist. But when it came to rehabilitation, rehabilitating her body after surgery and radiation, she wasn't the expert in that. That wasn't what she went to school for. And so just pointing out that there's an assumption that all people who have expertise in a certain area, they know what to do. You don't, and that it's okay to reach out and ask people for help. And how women have unique needs, especially young women, which we talk about often
Mhm.
at this time when it comes to cancer. They face challenges in thinking about they may be in the process of building their family or want to build a family in the future. So talking about fertility and what that means before treatment is huge. How that affects hormones. Some people get put right into menopause, many, many, many years before they would naturally be in it. So really, it was just an incredible conversation to talk with her. And now she changed out of her. She was focused in orthopedics, and now she helps other breast cancer survivors with physical therapy. So just an amazing story. And then also, very recently talking with Sakila Mykins, who is a birth
Mhm.
doula, something that you hear the word, but a lot of people don't really know what that is. They also think it's only for women in the Black community. It's for women in any community of any ethnicity and background. And so it was really wonderful to sit down with her. We have obviously a terrible problem in our country with maternal health and maternal mortality. And so it was really great to hear from somebody who had a personal story and experience with challenges during her pregnancies, who's now on the other side of it, as a certified birthing doula, how that can be a game changer in the delivery room prior to that and beyond as well. So definitely was wonderful to have that focus on all those different areas of women's health. And um, oh, and the other, I'm about to forget because we've done so many, is with our partners at the Allo Hope Foundation. They are so wonderful. They take and bring education and awareness to people about alloimmunization, where a mom can potentially um, have an antigen in her blood that can actually end up attacking her fetus or her baby's red blood cells. And there's a certain shot that can prevent that from happening, but there's the timing of that shot, and a lot of people don't know about it. It's a rare condition of pregnancy, and so we were very fortunate to spotlight that with both Katie Shanahan, who herself is a nurse prior to this happening to her during her pregnancy, and also Bethany Weathersby, who is the founder of the Allo Hope Foundation. What a story! Because she went from unfortunately losing her daughter Lucy to alloimmunization, not knowing if she would be able to grow her family um, naturally or in what way she'd be able to grow her family and get care, to finding care on her own through reading a journal article. Yes, reading a journal article and calling the lead author of that journal article, which is an incredible story, and then later going on to build this global organization, um, which is just always incredible to see. That's one of our other, I think, common themes is this entrepreneurship. People, so many
Yeah.
millennials see a problem in the healthcare system and they want to fix it. Even if they weren't a business major and
Yeah.
they want to fix it and they want to use their experience to fix it. And Bethany's a wonderful example of that. But yeah, so many fantastic guests in the women's health space.
Yeah.
Absolutely.
Okay. I
Yeah,
think
what
that
was
was
the
all the themes. So, are there any episodes you didn't get a call out that you want to, or should I go ahead and do the
uh
close?
the only other ones I didn't call out, but I don't know, were Dr. Granita's, Paige Sparks. So I could talk about some people reaching out to us who aren't millennials who want to speak to millennials. I don't know if that I should do that or not. The other, Paige Sparks, she came to us or no, Sarah found her, and she was so complimentary because we were more interested in her, but I don't know if I should say or not. We were more interested in her expertise. And a lot of
Yeah.
times the people you find on social media are just interested in your social media presence and not necessarily interested in what you do in the
Yeah.
health space, and maybe kind of segue into how, like, we are so interested in showcasing expertise and
Okay.
knowledge. Maybe talk about that.
So maybe what I'll do is I'll just cue you up
Or
to
a
talk about
surprise.
those two.
Okay, okay.
Um,
We
so
didn't mention
maybe,
Sujana. We forgot to mention Sujana. I was just looking, but I don't
oh
know.
yeah,
Yeah, I
I don't
know.
know if
You remember
there's an
so
easy way to tie her back in. I feel like Dr.
no.
Granita and Paige Sparks, I could say like we
Would
were
be
lucky enough to have some like maybe big names
yeah,
is the
that
way
would be
I'll word it
perfect.
in the
Yeah,
space. And then
yeah,
you can talk about both of them
yeah,
individually.
yeah.
Um, Anybody else besides those three?
Those are the only ones, and I wanna just
Okay.
double check what her law firm is called so I
Okay.
can I think it's Sparks Legal. Let me see, page let me see. Yep, I think that's it. You know what? Let me, because she had changed, remember that whole thing? She was in a different practice, and they
Yeah.
let me just double check my email. Oh, right, my phone is not on. Let me see. Which I'm glad I didn't because I didn't, I forgot to email my family and say, don't, I told them I would tell them, don't call me. Um, because this is the time that we're doing this. Let me see. I'm going into the YMyHealth account. Um, but I thought that was literally one of the first things that Paige said to me when
Yeah.
we were done. And um, I was so taken back. Let me see. And she's like, I'll come anytime. Yeah, because this email is from January of this year. So she switched over then. So Sparks Legal. So yeah,
Okay,
I can
cool.
talk about that. Yeah.
All right, perfect. So I'll cue you up
Oh,
to
yeah.
chat both of those.
And don't forget, before you start mentioning stuff with them, we want to talk about tee up about doing a navigating the healthcare system in the fall because we've
Oh
heard
yeah.
today. I mean, I'm happy to tee that up if
Do
you
you
want.
want to?
Yeah.
Yeah, I was gonna say, do you want to say that
Yeah.
after
These
you're
two.
done with these
Yeah.
two,
Yeah.
and then,
You do it.
um,
Yeah.
and then I'll do the close after that.
All the things, go to the survey, all the things that you
Yeah,
normally like to do. Money.
yeah,
We get to, yeah, all that stuff. Okay.
perfect. Okay, cool.
Okay. Yeah.
All right, so I'll lead us back in.
Perfect.
One of the other pieces I think that's been so exciting for the podcast in general is that we've also had the opportunity to feature a few of the bigger names maybe in the social media space. And so, Melissa, do you want to talk a little bit about our episodes with Dr. Granita and Paige Sparks?
Yes, absolutely. And that has been one of the really, really exciting things about this podcast is that you will reach out to people with very large followings, very busy schedules, and they're like, yes, I want to support. Like how can I be helpful in sharing my expertise? So Dr. Deanna Granita, who is the founder of Rheumatologists on Call, she's a rheumatologist. She has a PhD in immunology, and we had the pleasure of having her on. Now, she is not a millennial herself; she is a Gen X, and that's one of the interesting things is that we will find, and we have gotten multiple podcast guest requests on this. We will find people who are Gen X and some who are in the generation beyond that, in the baby boomer generation reaching out to us, wanting to be on the podcast, wanting to share their expertise with millennials, telling us how, and I know Dr. Granita said this, how important it was what we were doing because you're providing prevention way ahead of time, and she wanted to be a part of that. And so I think that has been such a wonderful surprise and a great thing for us. And then also, um, attorney Paige Sparks, who we just love. She has come on the podcast with us twice, and last time brought one of fellow colleagues of hers, member of her team. And one of the things Paige said, of the many interesting things Paige said, one of the ones that stood out was that a lot of people, of course, now, and a lot of our podcast guests, like us, have Instagram pages and followings on Instagram, and share content about their personal and professional lives. And one of the interesting things she said was that a lot of people, and I've heard this from other people as well, will come to her or to other individuals wanting them to appear on a podcast or wanting them to share information, but it's not the information you would think. They want them to share information about how they have built their social media following, and, about how they make their videos and all these kind of things. And so one of the things that definitely warmed my heart for sure is when we did our episode, she was so thrilled that we were reaching out to her for her legal expertise and to guide fellow millennials. Obviously, we always put disclaimers in there about legal advice because they can't go directly, but just to kind of give us a lay of the land in the world of law. And so I think that was such a gift to us to hear. It's such a really speaks to the credibility that we aim to have at YMyHealth. We are solely, and I know Julie will speak to this as well, we are solely interested in your expertise, your wealth of knowledge. If you are invited on the podcast, that is why, because we're looking for somebody who has spent years, and it doesn't have to be 40 years younger than that, we know, but years of time in your field. And that's what makes you an expert. Or if you're a patient and you have been living with a condition, you are the expert. Your doctor's the expert as well, but you, in partnership with your doctor, you are the expert with your condition because you're the one living with that body every day. And so we're interested to hear from you because we know that what you're telling us is real world information, right? And so I think it was really exciting to have her on, to have both of them on,
Yeah.
and to the other people to see that response. So yes, if you're listening to this episode and you would like to share your wealth of expertise with someone in the healthcare space, we would love to hear it
Yeah,
for sure.
absolutely. Yeah, it's really cool to see those people come and,
Yeah.
want to partner with us. I think that's been so exciting.
And speaking of that, and that enthusiasm, we want to keep that going, right? And so as we continue on in 2026 and into 2027 as well. So in that regard, as we were talking about earlier, we plan things out, not just ahead of time, which is Julie and my nature, very much, but we do plan our episodes ahead of time. But we plan out kind of what topics are of most interest, what is the greatest need at this time, and we learn that from you, from our guests, from our community who we speak with, and again, all over the country. I think we're almost up to contributors from 30 states at this point. um, and so knowing that, one of the great challenges that we've been hearing about from everybody for many, many months now is navigating the healthcare system. And we've touched on this at different times. We obviously touch on it a little bit within each episode, but we need more. That's what we're hearing from people. We need more. We have, for example, in my opinion, and I'm sure others, one of the most complicated health insurance systems in the world to navigate. And there are just so many barriers to getting that prevention. But let's just be honest. And so knowing what we're hearing from people, hearing the frustration, hearing how they're trying to find resources um, to make the best decisions they can about which doctors to see, which treatments to get, and to make sure it doesn't, you know, sideline them financially, we have decided that this fall we're going to be kicking off an entire episode series during season 2 on navigating the healthcare system. And that series will include episodes about insurance. And I know you're probably wondering, as we are, is there a way to make navigating health insurance easier? Well, we're all going to find out. From what I can see, there's hope. There's hope to be had. But knowing that this is the greatest frustration, Julie and I talk about this. We've talked about this with our sponsor, Dr. Sarah Diekman, and many others. This is the next phase we're going in. And one of the greatest joys about this podcast is being able to push the envelope in healthcare. We do that with our topics, whether it be, we talked about suicide prevention and mental health and back in April. You know, we just in areas of women's health that are not talked about enough because people are afraid to. We are ready to push that envelope when it comes to navigating the healthcare system. Every one of us knows, and every contributor we talk to says that we have a system that's broken, and we all know that. But it doesn't mean there aren't little things we can do to make it more manageable for each of us, even if we can't fix the whole thing. And so we're here to help in that regard. So really excited about that upcoming episode series.
Yeah, I think it's going to be great. Like you said, it's just something that so many people have requested.
Oh, yeah.
Um,
Oh, yeah.
and yeah, like you said, it's a theme. So I
Yeah.
guess, after 100 episodes, I think maybe what we can say is the biggest thing that we've learned is that health is messy, it's deeply personal, and it's rarely black and white. But over and over again, I think we hear the same message about, people are incredibly resilient. We
Yes.
want to learn more, and we're looking to do more for our health, especially in this millennial generation. And so whether it's caregiving, cancer, trauma, autoimmune, neurodivergence, learning how to advocate for yourself. What I think has stayed with you and I the most is just people
Yeah.
willing to share their stories so that someone else could feel less alone, so that we can learn from each other.
Absolutely.
And yeah, I think that's what we hope to do with YMyHealth, and what we've been working towards for our listeners for these past 100 episodes. And so, like you said, we've chosen season 2 based off the feedback that we've received
Yeah.
from our listeners and from our guests as well on the podcast. And,
Yeah.
Melissa and I, we're doing so much of this here on our own, but at the same time, we can't do this alone. So
Yeah.
your support is always really key to keeping us going. And so, we do have a survey to take in more of your feedback around all different elements of the podcast, whether that's the length of the episodes, the topics themselves, the types of guests that we have, um, different things that you want to hear or see if you watch us on YouTube from us. We'd love to hear from you. That's one of the, best ways that you can give back to us is by doing that. Obviously, we would also be very happy if you like and subscribe to the podcast on social media or your favorite podcast platform. But another kind of like last call out that we want to give is that, we're really doing this just the two of us basically. And so another way that you can support us, especially if you're a business, is by sponsoring the podcast. And so we have a variety of different sponsorship options available. You have heard the ads that we have from Diekman Dysautonomia and Sarah, who again, we're so incredibly grateful for her ongoing sponsorship. But if you have a business, or you're looking to do some personal promotion, we've got options that we would like to, feature you on the podcast in some way, and that really supports the work that we're doing and keeps this podcast going. So if you are interested in that, you are more than welcome to visit the website, fill out the contact us form, and we will be in touch. And again, thank you all so much for the support that you've provided, as listeners, as guests, as sponsors for these first 100 episodes. I don't think we could have pictured getting here, in
Oh.
2024. So it's amazing to be able to sit back and reflect on this, and be able to just like see what has come from it. And I'm so excited to see where it goes.
So am I. We are just so grateful to everyone who has supported the podcast. Everybody who wants to improve our healthcare system. As a millennial, whatever role that you are playing, whether you are a patient who is out there bringing awareness to your condition, if you're going out and you're going up to Washington D.C. or to your local representatives to advocate for change, to advocate for more funding, for research. Or you are working every day in the trenches, seeing patients, or in the lab doing research to bring change, and also health entrepreneurs out there. Always got to call them out, who have seen a problem and they are doing everything they can, working long hours to solve it, and building companies. We're just so grateful to all of those people who are out there doing that and who have found YMyHealth, and helped us build this incredible community. So thank you. It's been definitely, one of the most rewarding experiences of my life for sure. And I know, Julie, you feel the same way.
Yeah, absolutely. Well,
Definitely.
thanks everybody for tuning in for our 100th episode. And as always, stay healthy.